Hello and welcome to this webinar. I am Dr. Nikita Patel, and today we'll be talking about the role of vitamin D in eczema and weight loss. And I have a very cool presenter here, Dr. Enaka Yembe.
Hello, Dr. Patel. Thank you.
Hi. And stay tuned until the end because I have some things I want to share with you, some simple things you can do right away to support your skin health. So let's get started. What is vitamin D? It is, where is it made? The deficiency, how is it related to skin health and weight loss? And Dr. Enaka Yembe will talk about its relationship to weight loss, especially. So vitamin D is the sunshine vitamin, and it's produced in the skin when the sun rays hit the skin. It is a fat-soluble vitamin. It's actually a hormone. Acts on every cell of our body. And it's a fat vitamin, just like vitamins A, E, and K. So that just means its absorption is similar to the way fat is digested and absorbed in our gut. So when we take it in a supplement form, and it's important to take it with food so that it's digested and absorbed. And yeah, sun is an integral part in making this hormone, this vitamin D. And Dr. Enaka Yembe will go over some more sources of vitamin D with you. So yeah, Dr. Yembe, what's your take on vitamin D?
I mean, it's just really one of those essential vitamins, like you said, Dr. Patel. It is actually a pro-hormone. So what that means is that it is transformed in the body into a substance that is a precursor for hormones. It's one of those that's really important, and I am really big on weight loss. In fact, I do weight loss coaching, and the studies now show that, believe it or not, vitamin D is essential for weight loss. It has been shown to potentially reduce the formation of new fat cells. Can you believe it? In the body. So that's really important. I did mention that it was a precursor to hormones, and one of the hormones that it is essential for producing is actually testosterone. So if you're a man listening, vitamin D deficiency has also been linked with reduced levels of testosterone and reduced levels of libido. And so, those are just a few interesting things here about vitamin D. So, what can you tell us more? I mean, I've got some more to tell you about it towards the end. I mean, just really interesting. But again, vitamin D is essential for weight loss. In fact, there was a study done where several women, about 165 women, were chosen, and every single one of them was given the same low caloric diet, but half of that group was given a vitamin D supplementation, and the other half did not have vitamin D supplementation. And at the end of 1 year, the study showed that the women who received vitamin D supplementation had about a 7% weight loss compared to the group, more than the group that did not receive vitamin D supplementation.
Wow.
If you're on a weight loss journey, and you know me, Dr. Patel, I am forever on that weight loss journey. I'm forever on a healthy lifestyle change. Vitamin D supplementation is one of those things that I take, especially during these winter months. I know that you mentioned that it's produced in the skin. That's exactly true. And so during the summer, those of us who are outdoors for even 30 minutes during bright sunlight, we produce enough vitamin D through the skin synthesis or production. However, in the winter months, we don't have that benefit of the sunlight anymore. So I will take a vitamin D supplementation with my regular supplements every single day.
Mm-hmm. Yep. And yeah, I also want to add to that how much vitamin D we can make from the sun depends on some factors. So our skin color, the clothes we're wearing, are we fully exposing our skin to the sun, um, sunscreen, and the time of the day. So the time of the day when the UV rays that stimulate the production of vitamin D, that time of the day is from 11 a.m. to 1 p.m. That's when we're out in the sun, we're making vitamin D in the United States. And speaking for United States, and it's in the winter time, sun rays don't really hit the Earth's surface in the U.S., especially the northern states. So that's when, like Dr. Enaka said, it's important to supplement with vitamin D. And then there are natural sources of vitamin D besides getting it from the sun, but these natural sources are sparse. And one source is cod liver oil, which has a good amount of vitamin D in it. If you're taking cod liver oil, fish, some mushrooms have vitamin D, but we make the most from the sun. In half an hour time, we can make between 30,000 to 50,000 IUs
Right.
just in half hour. And with supplementation, we usually take um, from 1,000 IU to 5,000 IU daily. So in comparison, we make a lot from the sun. Yeah. And did you have anything else to add, Dr. Yembe?
Yes, I do. I have this nice little screen here. I had a little PowerPoint presentation,
Mm-hmm.
and I'm going to show everyone. I hope you can see this. Can you see my presentation, Dr.
I
Patel?
can. Yep.
Okay. And I have this PowerPoint presentation here, and I'm going to show everyone just a quick slide of some foods where we can that contains some vitamin D or additional vitamin D. Like you said, Dr. Patel, the majority of it we produce in our skin. However, there are some foods that contain some vitamin D as well. So we have some cereals here that are fortified with vitamin D. Orange juice is also fortified with vitamin D, and so is milk. Milk is not on here. Other sources of vitamin D in our foods include cheese, especially ricotta cheese, salmon, cod liver oil, that's a big source. Some um, mushrooms do contain vitamin D as well. And then I just wanted to scroll back here to some of the symptoms of vitamin D deficiency. And I say that because we have this a plethora of non-specific symptoms which could be caused by vitamin D deficiency only. So when you go to your doctor and you get your annual visit, it's a good idea to ask your doctor or suggest to your physician or your primary care provider if they could check your vitamin D levels as well. I did not know too much about vitamin D, to be honest with you, Dr. Patel, until very recently. And the more I studied it, I said, I should start testing my patients in the clinic. And I find that several people are just completely deficient. I'm seeing levels like 8, 5, 15. I mean, just low levels. And symptoms of vitamin D deficiency include chronic pain, muscle weakness, chronic fatigue, mood swings, depression, some respiratory or some breathing problems. Vitamin D deficiency has also been linked to memory loss. Like I mentioned earlier, erectile dysfunction, because it's one of those hormones that helps in the production of testosterone. It's also been shown to vitamin D deficiency has been shown to cause increase in fat storage, which can lead to diabetes. It can also cause dental problems, increase infection. So, just several symptoms of vitamin D deficiency. It is wise to replace or replenish your vitamin D levels if you have low vitamin D. So this is one thing you want to talk to your provider about. One of the symptoms that's completely lacking from this um, slide, and I'm going to let Dr. Patel continue, is the skin diseases that may be caused or may be worsened by vitamin D deficiency. And I know Dr. Patel, you're going to bring us some information on eczema, I believe.
Mm-hmm.
Okay.
Yeah. So vitamin D and eczema, there have been some reports that, said it may cause eczema, but what we mostly know is it's definitely linked to eczema. And there are cases of people with eczema who take therapeutic doses, so they're high doses for a short time, and their skin just clears up, it gets better. But that doesn't mean that it's a deficiency that's causing eczema in everyone. Just saying there's a strong link between vitamin D deficiency and eczema. So eczema is also known as atopic dermatitis. It is a chronic skin disorder where the skin becomes itchy, red, bumpy, and hardens over time due to an immune reaction to an allergen in the skin. And that immune reaction just continues and continues. And that's where you get that itchiness and red rash, and it becomes porous. The skin becomes porous. And then the itchiness leads to scratching, and then constant scratching often leads to skin infections, and that's where complications come in with eczema. It is most common in infants and young children, again, because when we're young, when we're developing, our skin barrier is more permeable, porous. So they're more likely to start reacting to things easily. It's getting into their skin, and their immune system's just mounting this allergic type reaction in their skin. And in the United States, it's incredibly common eczema, affecting 10 to 30% of the people. So again, in eczema, the skin barrier is disrupted. It's more porous on the outside. And because things can easily get into the porous skin, it tends to become easily irritated. And the toxins from the environment can also make the eczema worse, because the irritated skin is now becoming more irritated from something that, in a healthy skin, the skin immune system would take care of it, but in eczema skin, where there is just a lot of immune reaction, it would become worse. So aside from that, I wanted to talk about how a naturopathic medicine views eczema and what the treatment looks like. And then I want to ask Dr. Yembe what a conventional approach to eczema looks like. So first, with naturopathic medicine, it's supporting the skin inside out in addition to supporting the skin outside in. And really getting to the root cause, it's to remove whatever we believe is causing that reaction, so that our bodies, we don't have to depend on medication for the rest of our lives. And when it comes to naturopathic medicine, treating inside out is treating the gut. There's a gut-skin connection. Gut is an skin in the inside. And then we have this outside skin. So there's a gut-skin connection. And we are exposed to allergens that come from food in the gut, and then that can show up in the skin. And there's a liver skin connection. So with gut, it's important from a naturopathic perspective to heal the gut, and that's using 5 R's. So remove the offending allergen, replacing the function with enzymes and bitters, probiotics, repairing the damaged gut with herbs and then rebalancing to maintain the gut health over time and really enhance that liver detoxification pathways with herbs and nutrients because we want those allergens, those toxins, metabolized outside of the body, out and not go into the skin.
Mhm.
And when supporting the skin outside in, there are herbal preparations, so there are herbal creams that can be used to seal that barrier and soothe the skin from outside in. And of course, address deficiencies, especially vitamin D. And there could be other deficiencies, but today our focus is on vitamin D. So really look at the vitamin D levels that Dr. Yembe mentioned, check the vitamin D levels. In my experience, most of the cases, if a person is not supplementing during the winter months especially, their vitamin D is usually low, like low is below 30, and it's usually in 20s or 10s, and to really supplement that and maybe use vitamin D therapeutically in high doses for a short time. So, Dr. Yambe, what's a conventional approach to eczema?
Mhm. Yes, one of the things that we know about eczema, like you
Mm-hmm.
mentioned, is just the dry skin. And so the person who has eczema, they get into this cycle where the skin itches, they scratch, and then because they scratch, it itches more, so they have an itch scratch cycle just because
Mm-hmm.
of the dryness. So conventionally, we've been taught to moisturize or to avoid or prevent this skin dryness. So
Mm-hmm.
what we tell our patients, we tell them to moisturize, 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 to avoid things that could make the skin even drier or things that would irritate the skin. For example, we don't need to sit in the bathtub for 30 minutes, for example. Take a quick shower, 5 minutes, and be done, pat dry, and then moisturize, moisturize, moisturize. We also advise them not to use scented oils or scented soaps because, like you said, the skin is sensitive, it's more porous, it gets irritated very easily. So we avoid scented soaps, we avoid scented lotions and things like that. In addition to that, even just the way you do your laundry is important also. You want to get laundry a detergent for sensitive skin. You want to avoid using this clothes softeners and the dry sheets and things like that just because they irritate the skin even more. So
Mm-hmm.
that's essentially in a nutshell how we teach people about skincare. Then, if things are not better, then we'll use some anti-inflammatories, which could be topical, like steroid creams, or systemic, like
Mm-hmm.
injections or tablets. And so, that's just really our our conventional approach to taking care of eczema. There are some creams that change the immune modulation of the
Mm-hmm.
way the immune response in the skin happens. We'll use that for really severe cases.
Mm-hmm.
But in my experience with eczema, I tell my patients to be patient because eczema tends to be here with us for a really long time. And then, like you said, to treat from inside out. Most people who have eczema will have a flare up if they're too anxious, for example. I also tell them to watch what they eat because certain things, like you said, will cause your eczema to flare up. So to avoid that response, you want to be mindful of things that you eat that can cause it to flare up. Peanuts, big culprit there, spicy foods, another big culprit there. But I see especially people who are anxious, anxiety will trigger a rash and
Mm-hmm.
itching.
Yeah.
But before we end this presentation, I did want to mention the role of vitamin D in calcium absorption. It's really essential for your bone health, especially for women like myself, a little older, who are postmenopausal. It's really important that you take calcium for your bones and vitamin D with your calcium because vitamin D is what helps your calcium to be absorbed and really will help you maintain your bones. The majority of fractures that happen occur in women because when we go through in postmenopausal women, just from simple falls, because when we are older, our hormones change, levels drop some, and with that, the absorption of vitamin D and calcium is reduced unless you supplement it. So you want to intentionally supplement calcium and vitamin D regardless when you're postmenopausal, unless your primary care provider tells you you have a contraindication to calcium supplementation. So what that means is some people cannot or should not take extra calcium, and you want to always check with your primary care provider before you do that. So
Yeah.
I think that's it for me.
And I wanted to add to that, you mentioned calcium. I'm hearing my voice back. Um, yeah, it is calcium. Well, yes, too much vitamin D can be toxic for the body. It means it's absorbing more, the gut is absorbing more calcium from the food. We don't want too much calcium in the body because then it can dislodge and not dislodge, but it can deposit into arteries that are part of a plaque. So someone who has high cardiovascular disease risk and they have arteries, some arteries are blocked or a lot of plaque build up, then too much vitamin D can cause an increase in blood levels of calcium, and we don't want that. And to prevent that from happening, there is another vitamin to take with vitamin D. It's K2, MK7. It's vitamin K2, menaquinone 7, and its sole purpose is to take that calcium that we absorb from our food in our gut and put it into the bones. It helps it put it into the bones and not anywhere else where it can create complications.
Interesting. I did not know that.
And yeah, K2, well, we know K1 is a blood thinner, calcium. It's a vitamin that's involved in the blood thinning pathways. But K2 is, it transfers calcium into the bones. Yeah.
Very interesting.
Mm-hmm.
Anyway, so far, Dr. Patel, I think we came to the end of the presentation. I want to tell everyone I did not get any questions during the presentation. However, if you have any questions, go ahead and type those in the chat box and we will reply you or send you an email after the presentation. And I think we have come to the end of it, the presentation.
Yeah.
Well, I wanted to thank you so much for
Before we end it, though,
yes, please.
There were some things that I wanted to share, some simple things, 3 simple things that everyone can take away and right away. Everyone can use this information right away. And one thing Dr. Yembe already mentioned, ask your doctor, your physician to check your vitamin D levels annually and see where you're at. And secondly, the second thing I wanted to share with you was vitamin D3. There are 2 different forms of vitamin D that's found. Usually there's prescription form, which is D2, and there's over the counter, which is D3. And D3 works better. It works faster to replete the blood levels than D2. So over the counter vitamin D3 works a little better than the prescription D2. And in eczema, it's important that you avoid using olive oil or mineral oil on your skin. Olive oil, I know it's a healthy oil to ingest, but to not put on eczema skin. It's been shown and studied to make eczema skin more irritated. And then instead, to keep that dry skin moist, sunflower oil has been studied and shown to really help soothe the skin. And you can also use coconut oil or shea butter. but do not use olive oil on your dry skin. Yeah. So those are some things that I wanted to share with you, and hopefully that's very helpful for you and things you can act on right away. Yeah.
Wonderful, wonderful. Did you want to tell our viewers before we close here where they can find you? I am on social media. I'm on Facebook, Instagram, and on Twitter as well. And you, Dr. Patel?
Yeah, I am not on Twitter,
Yeah.
but I'm on Instagram, Facebook, and my website, sunshineholistichealth.com. So that's, yeah, you can find me easily on social media. Instagram is dr.nikki.nd, and Facebook page is Natural Medicine with Dr. Nikita Patel. And Dr. Enaka Yembe's page is just Dr. Enaka Yembe
Dr.
on
Nikita.
Facebook.
Board. Yes.
Yep.
Thank you so much. Thank you.
Yes.
Stay tuned, everyone. We will have more presentations on different topics.
Mm-hmm.
I'm really excited to be affiliated with Dr. Patel here, and we'll continue bringing to you as much information as we can share.
Yes, thank you so much, Dr. Enaka Yembe, for doing this together. It was wonderful, and you had such amazing information to share with us, especially about the weight loss and vitamin D.
Yes, yes.
Yeah,
Thank you.
thank you.
Thank you.
Okay. Bye.